Hello everybody and welcome back to Study with Julia. Today I'll be kind of resuming my medicine series, I guess, the medical specialty overview series. And I take a lot of inspiration from Kharma Medic's videos, especially because I really enjoy when he's on doing different specialties. I find his videos really engaging, so I did base it off of that. That was my kind of introduction to orthopaedics. And I'll link his video down in the description if you want a full explanation of what he did. But this is just kind of an overview. I've not done anything about this except for researched it. So this is kind of just, if you're looking into it, you're not sure what orthopaedics is, then I'm hoping that this is a good video to help you. Alright, so orthopaedics is a branch of medicine that treats musculoskeletal issues primarily. These issues can be treated both surgically or non-surgically and have many subspecialties, including but not limited to pediatric orthopaedics, so looking after bones, joints, muscles and tendons in children, adult reconstructive surgery, so caring for adults with arthritis, joint replacements and other conditions affecting major joints, or hand surgery, which is kind of misleading because it's actually surgical and non-surgical treatment of the hand and wrist. So according to the NHS, orthopaedic surgeons spend 40% of their time in surgery and 60% of their time on the wards. People of all ages and occupations can be helped by orthopaedic surgeons because everyone uses the musculoskeletal system so often, and that means that it can be negatively affected pretty often too. Common disorders seen by the orthopaedics department include conditions such as arthritis, fibromyalgia, fractures, lower back pain, the list goes on and on. For osteoarthritis, orthopaedic surgeons may start off with a non-surgical approach, prescribing pain and anti-inflammatory medicines as well as strengthening exercises, depending on where the arthritis is. And then, they might suggest something more invasive such as joint surgery. In fact, this could be a big part of the job, because arthritis is the most common condition seen by doctors that have specialised in the area of orthopaedics. The positives in the life of an orthopaedic surgeon can include, the fact that it is seen as a very rewarding specialty. You can often bring rapid relief to your patients and, you can see that happening, which is really cool. Due to the surgical aspect of the job as well, there are so many crucial skills that you are able to develop, such as communication, teamwork, problem solving, and the main one, I think, for surgical specialties, hand-eye coordination. Obviously, also, people don't just go into the job for the money, but the average orthopaedic surgeon in the UK earns around £86,000 per annum. So the compensation of the job is pretty good, It's pretty high. There's a wide variety of different areas to focus on, such as foot and ankle, hand, hip, so, it's never boring. And these are just a couple, there are so many more positives to the job than just that. Right, if there's positives, there's also got to be some negatives. So, orthopaedic surgeons often spend many hours on their feet, which can add to the tiredness from literally just working long shifts. All the brain work, all the problem solving gets quite fatiguing. And in fact, the hours can add up to 50, 60 hours a week. And there's also the possibility that you may need to be on call. If you're not too familiar with what this whole on-call thing is, I'll link my video down below explaining it to give you a bit more of an insight on that. As in many specialties, patients can have very unrealistic expectations of the surgeon. And if there's any post-operation consequences, then, patients might believe that that's the surgeon's fault instead of their actual ailment's fault. And I feel like this is pretty common in surgical specialties. This is why it's important to weigh up the pros and cons of any job, There's always both, and I guess it's down to you to choose in which job the pros outweigh the cons more. Okay, so as in any job, there's obviously going to be some skills required. So as previously discussed, communication is incredibly crucial for an orthopaedic surgeon to have, as there are lots of people to communicate with, colleagues on the wards, communicate what's going on with patients in the surgical suite, so people know what you're going to do. You can have the help and assistance, patients, letting them know, and their relatives what is happening. Manual dexterity is also key. Once more, surgical specialties, so that's going to be quite key. You need to be confident enough in your hand-eye coordination to be able to carry out a whole operation. So you need to have that one. As a doctor, high level of professionalism is key. You need to be able to be trusted. You have to maintain ethical and just behaviour. Pretty standard for doctors, I think, and many jobs overall. The last skill I really wanted to touch on is having a flexible outlook, because orthopaedics is a specialty in which everything has to be perfectly suited to the patient, because that's how you're going to see the best results. And you need to be able to recognise this and be able to put yourself in your patient's shoes to cater to them specifically and help them the most you possibly can, which is obviously what you want to do. Okay guys, thank you so much for watching this video. Please remember to like and subscribe, comment anything you think maybe I missed about orthopaedics. And I hope this was kind of useful as a short little kind of introduction to this specialty of medicine. And I also hope to see you very, very soon. Bye-bye.